But generally speaking, overall, I think they're happier. I think they just feel more content in their own skin. So my name is Dr. David Yeo and I'm an upper GI and bariatric surgeon. When people are thinking about diets, they're thinking about a specific diet. The problem is that most diets come and go, and the reason for that is that they tend to focus on one part of your life. These kind of radical approaches to diets tend not to work, and that's why you get yo-yoing and things like that. What you want is something which is going to work best for you over the long term. A lot of people go for no carb or no fat, or they decide that they need to do radical exercise or huge lengths of running or whatever. And these things tend to be possible for a short time, but not for a long time. And really that's the key to losing weight. You have to have something which changes your life for good. That's why bariatric surgery works, because from the minute you have the surgery, your anatomy and therefore your ability to eat and so forth changes. After bariatric surgery, what happens, most of bariatric surgery affects the foregut, essentially the stomach, the duodenum, etc. And by changing these things, and there are various ways we can do that, what happens is that it makes it easier to consume smaller amounts. As a result, you crave less, and therefore you can maintain these decreased amounts of food for a long period of time. It essentially allows you to do that. Bariatric surgery changes your ability to do exercise. When you have a BMI of 40, it's really hard to exercise in any significant or effective way. But as your BMI comes down, after you've had surgery, what happens is your weight will come down, you become lighter, it's easier to exercise and be active. The first thing is that they tend to have much more energy to do things, just everyday things. Things that are normally, if you don't have obesity, things that you can do quite easily, like going to the shops or walking up a flight of stairs. The second thing is they tend to sleep better. A lot of these patients have sleep apnea, and we know that bariatric surgery can improve that, and by sleeping better, that makes, not surprisingly, their energy levels better. They tend to have more control, and they notice this, and it makes them feel much better. That a lot of people coming to bariatric surgery do so because they feel as though they've lost control of their life. So it gives them a lot of sense of satisfaction to achieve that. Many people, when they go out with their friends who have not had bariatric surgery, they are surprised how much they used to eat, because they know they used to eat the same amount, and they're quite surprised by that. They're not worried by it, but they're surprised by it. But generally speaking, overall, I think they're happier. I think they just feel more content in their own skin. One of the commonest misconceptions about bariatric surgery is that it's an easy thing to do, or that it's an easy way out of obesity. A lot of people think that bariatric surgery is a bit like a magic wand, but really it's a tool. It's a really effective tool, just like an excellent diet or a good membership to a gym. If you stick to the rules of what you eat and how much you can exercise after bariatric surgery, it will give you the results that you want. That's the contract of surgery. Whereas if you have a BMI of over 40, for example, and you do these things, you'll see much less of an effect to these, difficult interventions. So it's not the easy way out, it's just something which is more effective when you stick to those rules. The second thing to say is it's a very active process. It really does require a lot of intervention in terms of sticking to your diet, interacting with your dietitian, getting support psychologically if you need it, maintaining a regular exercise regime. These things are important, they're active, and they're something that patients do need to do to get the best out of their operation. And the final thing is that you do need support from family and friends, and people who have the support of these people tend to do much better. Some good evidence that it has a significant impact on a lot of things. Most importantly, weight. There's randomised control evidence that it makes a significant difference to your weight, much better than medical interventions. Type 2 diabetes, there is excellent randomised control evidence that if you combine surgery with medical treatments in obese diabetic patients, they do better than patients treated with medical therapies alone. It has a significant impact on cancer. So there are certain cancers where it has a much more significant impact. Cancers like endometrial cancer, postmenopausal breast cancer, pancreas cancer, prostate cancer, and colon cancer. But it's important to remember that it decreases the all-cause mortality of cancer in patients as well, which is probably multifactorial. It also improves lots of benign medical conditions like gastroesophageal reflux disease, which is intimately related to obesity, and also things like osteoarthritis, obstructive sleep apnea, and fatty liver disease. Cheating on the pre-op diet is really important not to do, because what that does is it will, over that 2 weeks or 2 or 3 weeks that you're on the Optifast, what will happen is your liver, which is one of the most metabolic organs in your body, will shrink. How much it shrinks is variable. Some say 5, some say 15%. But the important thing is that it shrinks to the degree that it becomes very safe to retract during the surgery. Your stomach lies behind the left lobe of your liver, and we have to use a special retractor to lift that lobe of the liver up. If the liver is really turgid and tense, as it can be very commonly in obese patients, it can be very dangerous to do so, and sometimes we actually have to abandon surgery and come back after a longer period of Optifast. So it's really important to stick to that Optifast.